Hello, and thanks for your interest in learning more about American Exchange. This video should provide the basic framework for the services that we provide to Ryan-White organizations. My name is Andrew Hutzler, and I'm the Chief Operations Officer of American Exchange, and I'll be walking you through some of the software services that we provide to CBOs and ASOs that serve Ryan-White eligible patients. First, I want to give a little bit of background about American Exchange. The company was founded in 2013 to assist individuals with health plan enrollment in the newly created health insurance marketplace. Since then, we've evolved into providing software solutions for Ryan-White organizations. Our services are paired into two system categories: an enrollment platform coupled with a client relationship management system designed specifically for managing monthly health plan premiums on the individual market. Our enrollment platform provides a completely customizable consumer-facing site that allows clients to evaluate, compare, and enroll in a health plan. Our CRM, which we call MERDOC, allows our partners to directly access client data such as plan information and monthly premium amount. In addition, it gives our partners the capability to create custom reporting for managing monthly premiums, allows for case managers or administrators to submit customer service tickets on specific clients, and is updated on a monthly basis. In the next parts of this video, we will go into further detail about these two systems. American Exchange can build a platform for your organization that enrolls on-exchange medical, off-exchange medical, Medicare, as well as dental and vision products. The American Exchange enrollment platform is completely customizable to fit your organization's needs and goals, and falls into one of two enrollment methods. First, direct client enrollment. In this scenario, the client evaluates, compares, and enrolls in a health plan online, either on their own or with the assistance of a case manager or assister. This option comes with a live chat feature and telephone support if the client has a question about which health plan to choose. Our software can be completely customized to only show approved plans, approved carriers, or approved metal tiers. Second, the American Exchange ACA assessment. With this option, the client or case manager provides American Exchange with all the information needed for our agents to select and enroll in a plan that best fits the client's medical needs. In this method, we gather the client's information, which includes but is not limited to their prescription drug information, a list of doctors that they see and how frequently they visit that doctor, and a preferred hospital. We then take that information and enroll the client in their best plan option. This method has saved our partnering programs time and has significantly reduced program expenses on monthly premiums and deductibles. This is a demonstration of the Client Direct Enrollment tool. This is the site that the client would visit either on their own or with the case manager to evaluate health insurance plans directly. For demonstration purposes, we're going to enter the client's zip code information down here just to see what they would see while selecting a plan. The client would enter their age, whether they're a smoker or tobacco user. They can adjust their household size and enter their estimated annual income. Once all that information is entered, it'll produce an estimated monthly tax credit here. Then you can go down and select a health insurance plan. You can filter the plans by network, by health insurance carrier, or by plan type. Within each individual plan, there is an option to view the doctors that are in network, the prescription drugs that are covered, as well as a detailed benefit summary. You also have the option to compare up to 3 plans. If you have any questions about the plans that are available to you, you can use this chat function to speak directly to an American Exchange agent, or you can call the call center at the number provided. Once the client selects a plan, they would click Choose Plan, and it would take them to a form where they'd enter their information and get enrolled. This is a demonstration of the American Exchange ACA assessment form. The ACA assessment is a form that gathers all the client information that we would need to select the best health insurance plan for this particular client. It's an online form that can be completely customizable to fit your organization's needs and the information that you require to enroll this client in your program. Here's some of the primary information on the client. You'll see name, address, phone number, email, social security number, date of birth, gender, as well as other information that will be needed in the health insurance enrollment process. This will gather the client's household information, full name, date of birth, and other information on a spouse or any dependents that are eligible under the client's tax filing status. We also give the client the option to enter information to schedule a plan selection call for spouses or dependents who wish to seek marketplace coverage but are not eligible for premium funding in this section. Here we're gathering income information, what type of income the applicant receives, who is the income earner, the estimated amount, the frequency of that amount, and the name of the employer or the nature of the self-employment. Additionally, we request tax information, as well as citizenship information and other questions. Many of these questions are meant to mimic the marketplace application. The next section of the ACA assessment is where we gather information about the client's prescription drug usage, as well as information on the providers and hospitals that they see. You see here we gather the specific name, dosage, and frequency of prescription drugs to bump that up against the formularies that are available on the marketplace. We also get information about the client's preferred hospital so we can make sure that they're in a plan where that hospital is in network. We also gather the specific names of any primary care doctors or specialists, including HIV specialists that they may see. We also gather frequency of how often they visit those particular providers, as well as information about their past and expected hospitalization over the last year. The final step here in the final page is information about special enrollment periods if applicable, and any necessary disclaimers that may need to be signed by the client. Once all of this is submitted, an American Exchange agent would evaluate all the information and enroll the client in a health plan. That data would then be transferred to the CRM, which we'll go over next. The MERDOC CRM system is a web-based client relationship management system. I'm here at AmericanExchange.com where you would go to log in to this CRM. Here it would take you to a login screen where you'd enter your username and password. Then it would take you to the group level information on your clients. So here's a set of dummy information that we've created for demonstration purposes. You can see that from this view, you can see a list of initially just 10 clients. That can be expanded to up to 100 per page. You can also sort clients directly from this view by any of these fields. Last modified will show you the last client that a change has been made. Let's go in and look at a specific lead. Here you would just click on the client's name. You're going to see the client's basic information, which shows up on the left side of the screen. The right side of the screen is a little bit more detailed, and we'll go over each of these features. Here, you'll be able to see specific policy level information on the client. Click into the policy to see further information. Here you'll be able to see plan level information for the client. You'll see that there are subscriber ID numbers, plan names, the agent that enrolled the client, the marketplace application ID and effective dates, as well as unsubsidized and subsidized monthly premium amounts. There's a lot of information here that is useful for managing each enrollment. If we go back to the individual level view, you can see also a notes section where American Exchange agents can describe specific interactions with the client. There's also a section for dependent information, as well as documents that the client may need access to. So here you can see that the carrier welcome letter is stored. The case manager can view or download that document, as well as the client's eligibility notice from the marketplace. That can be viewed or downloaded. Additionally, there is a help ticket feature. So here is an example of something where a case manager's come in and requested a help ticket or a customer service ticket on this particular client. You'll see that the ticket is lead specific. The message, the client requested ID card to be sent to his home address. An American Exchange agent responded, emailed the case manager, and had carrier send new card to his home address, and the lead was marked as resolved. This is a look at the individual level. If we go back to the group level, there is a section for group level documents as well. So if there's any eligibility notices, eligibility requirements, or any disclaimers or notices that need to be held on a group level, that can be held here through the CRM. And it's something that we've created to show changes, recent changes, and pending and canceled policies. So what you see here is the clients that are sold under your group, and additionally you'll be able to hover over the client to see any changes. So let's look at John Smith. You'll be able to see the date of the last change, which was September 11th, 2017. The user who made the change, field, the event, so that's just marking that the client was sold or enrolled. So that's the last change for that client. It also goes into further detail on a policy-specific level. If we look up here at Michelle, you'll be able to hover over this and see the events that have happened in this client's file. So you'll be able to see here that on the 12th of September, I changed the subsidized premium from $433.34 to $403.34. Now maybe that's from a change in income through the marketplace, but you'll be able to see that change there. So that's useful in changes throughout the year. You'll be able to see what's going on. You'll be able to document any changes, and should really help the program operate more efficiently for premium payments. In addition to the sold policies, you'll be able to see policies that are canceled. You'll be able to go into the policy-specific client, and you'll be able to see any notes on why there was a cancellation. You'll be able to see any pending leads, which are leads that haven't been enrolled yet. Maybe we're waiting on additional information on this client, but you can go in and see those leads. The reporting functions of the MERDOC CRM are something that are going to be very valuable in administering the monthly premium payments. Let's go up here to the top of the screen where you click Reporting. This is going to take you to a screen where you can pull one of two enrollment files. There's an enrollment file and a payment file. We'll go over the payment file in a little bit. That's going to be for ongoing premium payments. The enrollment file is meant to pull information for issuing the binder payment or the first month's premium payment. For demonstration purposes, we've pulled an enrollment file for January 1st, 2018. And I'll show you what kind of information is on that enrollment file. Here you'll see some of the initial columns. Name, date of birth, social security number are included in this set of data. You'll see the client's address. You'll see the plan type, which on exchange, off exchange. You'll see here, for example, private dental as well. So we have the ability to distinguish between on and off, as well as other plan types. You'll see the health insurance carrier, the plan name, and marketplace application ID. You'll also see the client's member ID and group number if applicable. Then you'll see the binder due amount. So that is the amount that the health insurance carrier needs to activate the policy. The monthly recurring amount and any monthly advanced premium tax credit are also listed there. There's a column with payment memo line. So that is something that is meant to be printed on the physical check that is sent to the health insurance carrier. And it's got the plan effective date. Additionally, it has information about the payee. So this is the information about where to send the check for the specific carrier. You'll see here that there's two different addresses for on and off exchange policies. Our system can be built to administer two different addresses for on and off exchange if that carrier is set up that way. There's also information on prescription drug information, as well as pharmacy phone number and customer service number. Again, this is the file that is used to send just the initial binder payment. Next, we'll go over the payment file. The payment file differs from the enrollment file slightly. The payment file is built for ongoing premium payments and is really meant to capture any credits or debits throughout the year. So I want to kind of show you some of the features of the payment file, how that's accounted for in the CRM, and how this can really help your program manage payments that are made off cycle, maybe a payment that carried over from last year to next. Maybe there was a credit owed from 2017 that's being applied to 2018. This will allow for y'all to account for those changes. So specifically what we'll do in here is we'll go and look at a lead here, and we'll go into the policy information. What you'll see here on the right side here is a payment adjustment section. We've added this payment adjustment for demonstration purposes. What we've shown is a credit of $637.47, which is the client's regular monthly premium. So this would indicate that two payments were made on the binder payment. Okay, so what we'll do is we'll go to this reporting tab, which will pull up our report type or request report page, where you would pull the payment file for February. So I'll go ahead and show you what that looks like. Here you'll see some of the same information that's on the enrollment file, the client's basic information, social, date of birth, address, plan type, carrier information, marketplace application ID. Most of this information is not going to be different from the enrollment file. What you'll see differently here, though, is a premium amount total. So this is meant to give you the amount due for the month of February. If you remember, there was a double payment made for this client in January. So there was a credit in February of his premium amount. So you'll see here that the client owes $0 for the month of February. That does not change his monthly recurring amount, however, since it's just a credit for 1 month. Notice how other clients, their monthly recurring premium and premium amount total are matching. That is because there was no debit or credit on to their payment adjustment. So you'll see here any kind of credit or debit can be captured and it can be administered on this payment file. The payment file is meant to be pulled monthly for the next month. So similar to a health insurance billing cycle, you're going to be able to accurately account for health insurance monthly premiums using this system.